what do you think is the most valued element, the value that you put on top? Is it freedom? Is it equality? And do you think that this actually affects your society? Are there other factors that I could have missed, maybe geography or other factors which could shape society and the way we consider social protection policies? And maybe above all, when we consider universal versus targeted schemes, what can explain that some countries they move forward universal coverage, that some other countries are more reluctant to do it, and even inside, for example, let's take the example of Thailand. The idea of universal coverage is accepted maybe for health, but for children we can say that they are still reluctant to do it, even though there are evidences that it would not be so, that the cost would be very similar. So how can we explain this, and what is the situation in your country?
I just want to add, like, other factors. I think there's been a strong global movement, and I think more and more of us are watching the American elections very closely to see which of the boxes it will fall in and how it will affect world economy and approaches. So I do think one of the other factors would be the global markets, and I think especially countries in ASEAN in particular moving towards an ASEAN economic goal by 2015. If you look at the blueprint, it is all related to economic achievements. And if you look at the socio-cultural blueprint, the distribution issues do not seem to be so clear. It becomes quite national after. So the distribution, I think even at a regional level, so I think some of the regionalism and the global movements could be other factors. Another factor, I think, perhaps within the ASEAN context will be the role that the monarchy plays. I think in some of our countries, the king takes a very big role in the social contract. In some others, perhaps Thailand, there's a parallel system of almost helping the poor through enterprises, etc. So maybe another factor would be the monarchy. And my last comment here on freedom and equality, I'm trying to figure it out where Singapore is concerned, and I still do not know how to interpret it for my own country. Yes.
The question whether is there any other factors that actually will shape the social protection in the country.
And the way we think of society and helping the others.
Apart from, in terms of the global economics, so I think I just want to point out to example of Thailand when we actually move from the mean benefit scheme of the old age pension to universal. Apart from the poverty of older persons, which is higher than other age group, is actually occurred during the financial crisis. So this may I forget the name?
Yeah, the shift in how wealth is distributed.
Yeah, so this economic crisis is actually play a role, the global one, in the social protection as well. And the other thing is about the different segments of society. You mentioned that actually child care allowance in Thailand is not really being pushed. I would say that it actually because of the participation of different CSO play quite a big role in some of the countries where the political context allow and can really shape and how people look at the social protection. For child care, we feel that CSO are not buying in this idea. I don't know why for some reason. And that's probably one of the factors, maybe not all.
To make a new policy or to develop policy, you need to analyze the context of the country. And this context is very important in the ideology. For example, in Sudan, which is a universal Islamic country, or Indonesia, also can depend on people look freedom and equity together, and zakah can play a major role in universal coverage, because you're looking for who to cover the poor people. And usually this model is started in Sudan. Now zakah in Sudan cover like 600,000 families. And if develop these models and other models can reach universal coverage. And also thank you very to government in Thailand, because the government of Thailand also through universal coverage do many lessons to developing country. This can be happen also in African country. Thank you very much about to be like this. And I usually not like to be yes or no. I like multiple choice, freedom, equity. Also, all this work together. The mechanism also can work together, not only one mechanism.
I would like to perhaps share our country experience. So there is another factor, I think, learning from the failure. Of course, the failure that I refer to also the either market failure that end up with the crisis, like I think in 1980 to 1990s, we more actually follow what they call it, the World Bank economic market. So more the market driven that endorse the privatizations as well as the deregulation, which is less the government intervention in the economy. But of course, we learning also from experience that, particularly in our countries, that there's also government failure, because it's stated clearly in the constitution that the equalities has to be secured, but the distribution was the problem. Entering the democratic political system, and then we acknowledge the equality, but also the freedom. But of course, another factor, I think, the political process, because not really the government can make it happen on the social protection issues, but also another non-state actors that influence the process. Even though the process could be lead to the more market, but also is maybe to rigid regulation. So I think I can conclude that it's more on the actually in the midway of either more market and government, but also having that we have more the failure of the redistribution of the economic or the growth itself. So we have still 40% of the population is the poor, which is we have to actually proceed with the targeted scheme. But of course, there is another assessment, SPF assessment also concluded that there isn't in between formal and poor, there is an informal which has not been exposed for any social security scheme. So universal coverage must be actually also enforced. But again, there is a problem with the government's capacity, fiscal space, that if we actually proceed with the universal coverage, so how the money is actually come from. So and really actually the political process is important, I think.
Just one precision. I don't ask you to choose between freedom or equality, but it's more to know how in your country do you think these two elements are balanced. But it's not like, well, I choose freedom.
Okay.
What strikes me in Indonesia is that you have some provinces who are going ahead of the reforms, and are promoting some kinds of universalist models, yeah, where for health particularly, because they have also more power to do it, and some of them have even the financial resources to do it. Whether others have still. So I would like to know, since there is also a lot of cultural diversity between the different islands and provinces in Indonesia, I was wondering whether this also may have an influence on the policy choices that can be made within a country.
I think what I see is in the national level, they already actually what's it called, confirmed that the universal coverage to be enforced. But the problem is in the regions, they already have actually more advanced in some, now we're starting with the health scheme, health insurance schemes that has to be actually covered for all the population by January 2014, the 1st January 2014. And then there's some example, like Valerie mentioned, that in the Kabupaten level, the sub-province level, they're already more advanced comparing with the others, which is already enforced the universal coverage. But when we're talking about the more the national level, there is not they still actually have a problem with, as I mentioned earlier, that the budget capacity and how to actually extend the coverage to the uncovered groups. So perhaps like what we intend to actually do is we need to actually, take some example in the province that maybe can be the model.
But you think that the differences between the provinces, it's more a question of funds, or it can be maybe also cultural or religious?
This is not a challenge that once the national system need to be implemented, whether the models or the practice that already occurred in the province level has to be actually integrated into the national level one. So we still, I think my interaction with the National Social Security Council, they not really have an idea how to actually implement this or make use of the example in the province level to do it more national level. But I think, I don't know, single window service that we're trying to implement it could be, but still actually in the feasibility study.
Some other factor that mean that lead to the very difficult for the government to be to do the decision, because the other political party, they have their own policy that provide free of charge. So we are now close to the time frame for the election next year, and also we try to convince government this year that want to introduce prepayment scheme and contributory scheme for the non-poor, that the government now still consider that. So this is the factor lead to difficulty the advocate to our government.
Just some additional comment on targeted versus universal program. I see that in the experiences of many countries, it's more of an issue of ideology than budget. For instance, in Indonesia, I know that every time the discussion starts about universal coverage versus targeting, it's always the argument that it's not justifiable that for the government to pay for the non-poor. Whereas if we see it from the taxpayer's perspective, this way you have the rich and some of the middle class paying for the tax, knowing that their tax money goes to other people, which are in this case the targeted population, the poor, and most of the time the middle class is completely out of the picture. And when you have a universal coverage, maybe you need to increase tax a little bit, but when the program is working and the program is running properly, they know that it benefits everybody, knowing that there might be some cross-subsidy within the system. As long as the program is working properly and everybody benefits from it, then there's more also trust to the government, and there's more confidence of the system. And we of course know that in many cases targeted programs are more difficult to administer and cost a lot of money. Targeted programs in Indonesia cost between 10 to 20% administrative cost, whereas more universal programs cost less than 5 or 6%. So, and we have to also look at it how social protection is put more at this point as anti-poverty programs. It's not yet using rights-based approach. It's not detached from anti-poverty programs, so it's not something that everybody should enjoy. Thank you.
For developing countries, the welfare state is very necessary for the poor people, because the people themselves is very low incomes and cannot afford to pay for the social protections. So the government in developing countries have increasing roles to play in terms of social protection. But actually, if you look at all the developing countries, the fiscal space is very limited, and the revenue of the government limited. So the government itself cannot run the social protection program, especially. So there are two choices: whether the government is non-contributories or contributories. Because social protection is a huge program, and inside a lot of the scheme inside. But schemes can be, some scheme can be voluntarily, some scheme must be contributory scheme. Yes. So it depends on each country. Yes. So each country can see different importance, significance of each scheme.
When we talk about the fairness, here maybe some people can say that why I have to pay the contributory for the specific group. But this is not new. Maybe the taxmen, they know the argument quite well. Why they tax the rich quite high than the poor? Because they argue to the rich that you want the poor to bother you, or you want the state to protect you on behalf of you. And here the universal and versus target scheme, it can be true too. The social protection is aimed to protect the poor and the nearly poor to be dignitily living, and they try to be able to legally earn their income. So if we are not considerate of them and we let them freely and flow like freely, who will be affected? It will be the rich, or it will be the one that don't want to pay for the target scheme. Maybe they have to hire other people to protect the poor not to come to their house. Otherwise, maybe the poor come to their house, request for the money, request for that. So I think it should be all right to have some target scheme. Even some people may complain, especially maybe in the United States, they always complain that why the rich need to finance the poor. But I think it can be true too that let's say choose whether they want to hire the protector by themselves or they want the state to protect them, provide them the targeting people to train, better skill, and then maybe the rich, they will be able to utilize those poor that will work for them. So their well-being, their welfare, I mean the welfare of the rich may be good too when the poor become more skillful, become more useful for them.
I would say the universal and the target scheme actually, like many of us say, in each country we probably have to go for different schemes. And however, in terms of universal scheme, it will relate back to the social protection law. So the Euro scheme should go for a minimum that should cover all, so ensure that everybody will be covered. But then targeted scheme can also have its own role, because people have different vulnerability and should be also be addressed. And in terms of targeted scheme, if we only go for targeted scheme, there are lots of evidence that there will be lots of, you probably heard of these exclusion errors. Those who are actually should be receiving support are not, because of the implementation issue. And so I would say universal and targeted scheme have different roles and functions.
I would measure everything, the effectivity, relevance, quality, effectiveness of social protection from the prism of human dignity. What will improve the dignity of the human person? That is, I think, the central and the core value. And around that benchmark, you will have another two types of polarity. It is between subsidiarity and solidarity. Where a situation occurs that more people are poor and very few are rich, so that solidarity prevails. But where there is more or less equality, subsidiarity prevails. On the other hand, there is also the fight between individual responsibility and individual freedom. I support the notion that people should be able to set up their own social protection. That's why I wonder why we haven't been discussing the concept of extended family as a form of, as an institution for social security. We go back to the Neanderthal man. But that is it. In many countries, the extended family becomes a form of social security institution.
I want to take up a comment put up by Tony about using the family model. From the Singapore's experience, I think it is a good model that worked in the early years, but it also meant, from a social protection perspective, that the government can take a role further back because the family steps up. And with changing demographics of a population that is growing older, by 2030, 25% of Singaporeans will be aged 60 or 65 and above. You have a smaller pool of people to do the caregiving, and if it is still the family that is we are depending on to look after children, to look after parents, and to look after grandparents, when I'm a 40-something-year-old, it is no longer sustainable.
Everybody say that the economy should be caring for people, that the government should care for the people. But we also know that social protection should never be separated from the economic model of the development. And our economy has changed a lot in the past decades. And so if we try to still think in the way that it used to be, we learn from the experience of Europe or America, those are already in the past, actually. We know that the world has changed so rapidly, and the source of growth has been in Asia, and the model of growth in Asia has been totally different. And I've been studying economic development also in Asia. So different, the model that we develop in Asia than in any other parts of the world. So if the philosophy nowadays about social protection is actually no longer about giving social welfare, no longer the framework of giving, but it's more about enabling. So giving more tools for people to empower themselves. So that what? So that in return, they can contribute more to the economy. Because the source of economy is not the government. The motor of the economy is not the government. It's the people. And it's only the people, and if
if we want this to be sustainable, the support for market economy is actually social protection systems. Because we need the people, we need to always energize people in the economy through social protection. So regardless of whether we think that this should be universal, targeted, I think universal, targeted, voluntary, contributory, this is more of the different options that we should think along the way, and we should not be fanatic about one tools or another, because things really depends and change depending on time, depending on context. But one thing about social protection also is that this cannot be given by somebody to somebody. There should be some level of ownership by the people, because once there's this feeling that I just accept and somebody is giving, and most of the times we don't realize it, but employers associations, even workers, they still have that mindset that it is all right to receive something. But receive should be take and give in order for it to work in sustainable time period. So contributory scheme is something that should be present, mandatory. Maybe not for all benefits, but something should be mandatory and it's contributory. Otherwise, the government will not be able to sustain it. The family definitely won't be able to sustain it. And even at the personal level or company level, nobody will be able to sustain such a different challenge that we face in the world economy today. The challenge is much bigger, the risk is much bigger. So if we consider everything still in the micro sense of protecting our own self, our own family, then we'll diminish. Absolutely, for sure, I think. I'm very convinced of it. Thank you.